Hi, my name is Katie.
And my name is Cole. We work in the Learning Disability Programme at NHS England.
We are at the NHS England Customer Contact Centre that deals with concerns and complaints about GPs, dentists, pharmacists and opticians and specialist services for uncommon and complex health needs.
This film is about when people with learning disabilities, autism or both, want to give feedback, raise concerns or make complaints. It is also about when families, paid carers and friends want to do it on their behalf. Whether it be about health, social care or education, this film is about helping people to have good outcomes.
Just like my friend Aaron. Aaron, come on. It's okay, you can do this.
Good morning, you're speaking to Amelia from the Customer Contact Centre. Can I take your name, please?
My name is Aaron. I want to complain about a doctor.
Okay, that's fine. I just need to ask you a few questions first.
Aaron, tell him you have a learning disability and autism.
Can I just tell you, I've got a learning disability and autism, and I'm finding this phone call pretty difficult.
Ask if something is making the call hard or if there's anything you can do to make things easier.
Don't worry, we can take it slowly. I can always repeat what I've said or use different words if that helps.
Learning disabilities and autism are lifelong conditions recognised in law that you might need to make reasonable adjustments for.
Thanks for giving me your details, Aaron. Can I ask for your consent to contact the service you want to complain about?
Please explain any hard words like consent, or even better, just don't use them.
Your consent means it's okay for us to get in touch with them if we need to.
Yes, that's okay. I give you permission to speak to my doctor.
Have you complained about this before?
I don't like complaining about people.
What is your complaint about? I'll take a few notes as we talk to make sure the information we give to your GP is right.
I had an appointment and I couldn't understand what the doctor was saying to me, and I asked him to speak to my support worker instead of me.
So you went to an appointment with your GP and you didn't understand what they were trying to say?
No, I had a phone call with my GP because I asked him to ring me regarding my medicine. My GP said I don't need to speak to your support worker because I've already told you what to do.
Does the GP know that you have a support worker?
I don't know because I usually see another doctor.
Okay. What would you like us to do for you today?
I want the doctor to say sorry for saying words I don't understand. He did not listen to me and he should have spoken to my support worker.
Yeah, that's called a reasonable adjustment because of your disabilities. It's your right to ask the doctor to talk to your support worker if that's what will help you. Okay, I'll pass this information on to one of our complaints officers to investigate. The complaints officer will look into your complaint. One of them will get in touch to let you know what's happened.
In some other organisations, one person might stay in touch from the beginning to the end. You will need to explain this clearly so the person knows who will be in touch, how and when.
Thank you. I feel so much better speaking to you about it, Amelia. What are reasonable adjustments?
Okay, so the law says organisations should change how they do things to help you if you've got a learning disability, autism or both. That's called a reasonable adjustment. So you could ask the doctor to put it in your notes that you have a learning disability and autism and ask them to make sure they speak to your support worker as well as you next time.
That's great, Amelia. Now can you please check Aaron understands?
Okay, so just to check, what happens next, Aaron?
Someone will be in contact with me again. When will that be? And they will speak to my support worker as well as me.
I'll arrange for someone to contact you in a few weeks' time. When would be best for you?
After 10, please. And will I get in trouble for complaining?
No, it's always good to say if you're not happy about your care or how somebody is treating you. NHS England spoke with the practice manager about Aaron's concerns. They were very sorry and said the doctor didn't know about Aaron's disabilities. The practice manager rang Aaron to talk about how they could support him better in future to make sure it doesn't happen again. All teams who receive feedback, concerns or complaints have an important part in helping people. Often it's about the simple things, like taking a bit more time to help someone, explaining things better, having empathy and understanding, saying sorry and meaning it. Someone's quality of life and even their safety may depend on it.
Nobody complains just for the heck of it. People only complain when something's really wrong.
It's important to get feedback from people because we can't make changes to our service if we don't know where we're going wrong. Or equally, if we don't know where we're going right, we can't share that learning with other departments across trust. That's what's gone marvellous there, and you need to implement that in your area if we don't know.
I feel that there could be more reasonable adjustments in the process of taking the complaint and feedback.
Make it very easy for them to connect with you so that there is a lack of frustration on both sides and so that you can kind of do your job as well as you need to and go home feeling like you've done a good job instead of both parties leaving frustrated and probably angry.